Hello, my name is Jeffrey Clark, and today I am here to present my PowerPoint presentation over the disease Rocky Mountain Spotted Fever. My name is Jeffrey Clark, and here we go. To beginning, we were asked a few questions about what we should about what the organism is, and to name name the organism, and whether it's what kind of microbe it is. So the name of the organism that causes Rocky Mountain Spotted Fever is the Rickettsia rickettsii. It is a bacteria that is hosted by ticks and other small arthropods. It is a gram-negative bacilli that develops inside of these small arthropods or bugs and develop to a point where they can invade other eukaryotic cells, because that's what they feed off of. So can they be cultured in a laboratory setting and isolated? So Rickettsia and rickettsii cannot be cultivated on an agar plate or in a broth. They can only be developed or grown in eukaryotic host cells, and to do that in a laboratory setting requires very specialized equipment and the time and effort to develop these and to isolate the bacteria into what they are, because they're so specialized and living in these cells they feed off of. So the next question was to ask about where this can be found. Well, the Rocky Mountain Spotted Fever got its name from the Rocky Mountains here in the United States. However, it can be found throughout the entire United States and even northern parts of Mexico. The American dog tick, which is one of its hosts, can be found, like I said, all across the United States, eastern, central, and western U.S. And then the brown dog tick can also be found in southwest United States and even northern Mexico. Most of the cases, by most I mean about 60% of the cases, come from about 5 states usually, and those states are North Carolina, Oklahoma, Arkansas, Tennessee, and Missouri. So how it causes the disease. So what Rickettsia rickettsii actually does, when it invades its host, it will then cause severe blood vessel damage or vascular damage, and by invading the smooth muscle inside of our veins or inside of our bodies, and they can even spread to the endothelium. It can cause hemorrhaging and even consume platelets in our vascular walls while it's repairing, while our body is fighting it off. Another thing that it does is this bacteria actually uses the host's ATP for its own energy needs, and that's why it is almost as if it's in a parasitic relationship with its host. So signs and symptoms of this disease: you can have normal symptoms which are less severe. However, most of the time, if left untreated, it will develop into more severe symptoms or cases. So the normal symptoms that you need to be aware of whenever you have been bitten by a tick, or you know you've been bitten by a tick and you're feeling ill, are high fever, chills, severe headache, muscle aches, nausea, vomiting, confusion, and then you get a very noticeable rash around and spreading to other parts of the body from where the tick bit you. Once you start feeling sick, there's usually a symptom time about 5 days before the symptoms can start getting worse, and it's a lot harder to treat. So in these serious cases, you can actually get inflammation of the brain, inflammation of your heart and lungs. You can actually develop kidney failure and renal failure, possible amputation of the arm or leg or appendage wherever you were bit by the tick, And then if left untreated entirely, it is a very fatal disease, up to 80% fatality rate from Rocky Mountain spotted fever. So to diagnose this disease is actually very difficult. So the first thing we have to do is always inform your doctor of the symptoms of the fever. You have to be aware of the common symptoms and just also be aware of knowing whether you've been bit by a tick. So if you know you've been bit by a tick and have fallen ill, you need to let your doctor know immediately and then go in to see them. So your doctor may take a blood test if they see that it's necessary, and with the right information that you've given them on tick bites in your area that you grew up or you were in prior to feeling sick. However, the problem with the test is it actually takes a few weeks before you can get the results back. And that we go back to one of the first slides where we said that it's so very difficult to actually culture these organisms in a lab setting unless they have host cells that they can actually develop in. So most of the time when doctors prescribe antibiotics, which is what is needed to fight off Rocky Mountain spotted fever, they'll do it on speculation and predictions rather than sound results. So treatment, if left untreated, as I said, it could be anywhere ranging from 20% to 80% fatality rate. Most of the time it's in the higher percentages with that if it's left to its own devices. However, early treatment with the antibiotic doxycycline is very effective in combating Rickettsia rickettsii. The doxycycline is a tetracycline antibiotic, and those antibiotics are broad spectrum when dealing with diseases caused by this bacteria. And again, early treatment is very effective in fighting Rocky Mountain spotted fever. And in fact, best cases fighting the fever is within 5 days of onset of disease. And then finally, prevention, which is one of the easiest but also most difficult things to do, especially if you live in a very rural area. So prevention, you can take many different actions to help prevent the spread of Rocky Mountain spotted fever. And that's the thing too, is it is not transferable by humans to human. It is only transferable from tick to human, and we cannot spread it after that. So preventions of this disease can be as simple as wearing long pants and long sleeves. You can use insect repellent when walking in wooded areas or rural areas. You're consistently checking for ticks from getting inside from your rural area or walking in brush. You want to check yourself after that just to be aware of the possibilities of contracting or getting bit by a tick. You can actually tick-proof your yard. So to do that, you need to basically clear out roughage. You can clear out leaf piles, do all that just to kind of clear your yard out of any places where ticks may go to. And then finally, you can actually, when being bit by a tick, the longer the tick is attached to you, the more likely you are to contract the disease. So the faster you are to getting rid of the tick off your body, the better chances you have of not even contracting the disease. So to remove a tick, you take tweezers and you grab it as close to the skin as where it bits you as possible to grab the head, so you don't squeeze the body and all the juices that it's in the body of the tick into you. So you want to grab the tweezers as close to the head, close to your skin as possible, and then pull up until you finally get the tick to remove itself from the body. And those are some of the simplest ways that you can prevent Rocky Mountain spotted fever from affecting you and the people around you in life. So thank you very much, and have a good day.